An absolute honour to have been invited here to speak to you at this conference on the theme of building a culture for occupational health. What I would like to do is actually tell you about how we are building a culture of occupational health and well-being in our National Health Service in England. You may know that our National Health Service is the largest employer in Europe with 1.3 million employees and approximately 70% of women in the workforce. Prior to COVID, NHS occupational health services had been under-resourced and under-invested in for many years. Therefore, when we did hit COVID, there were not enough of us, and certainly not enough experienced occupational health clinicians to be able to deal with the task in front of us. And it's really as a result of that the government realised, and certainly our leading body, NHS England, appreciated the need to have more trained occupational health practitioners, investing and developing occupational health to support what is a very valuable and the most valuable resource that a healthcare sector has, which is, of course, its workforce. As a result of this, there was the birth of what I call developing and growing occupational health and well-being in the NHS, and it's a 5-year strategy that was launched last year in August. So we are in the current first year of this 5-year strategy. What I'd like to do is just share with you the journey of how we've got here in launching this 5-year strategy. So back in late 2020, early 21, we started with what was really our consultation stage, where we started with senior leaders, so our CEOs, our HR directors, and also national organisations such as the Faculty of Occupational Health, our Department of Health, Public Health England as it was at the time, but also the users of occupational health services, i.e. our employees. And also the most important people in delivering such a strategy, of course, is the people who work in our occupational health services. We had surveys, stakeholder engagements, and we learnt a lot about what good practice was out there, where the gaps were, where we needed to be. And so came that second phase, our discovery and gap analysis stage. And through that stage, we learned a lot about the differences in all our different hospitals across all of England, and as a result, then launched our 5-year strategy. So, what is our 5-year strategy? Our 5-year strategy basically focuses on 4 drivers, and these 4 drivers were actually really concluded and created as a result of all our stakeholder engagement and our gap analysis. At the bottom there, you'll see our 4 drivers: growing our strategic identity as occupational health and well-being services, growing our occupational health and well-being services systems. And for those of you who are not familiar with how hospitals are organised in England, hospitals are actually in each sector, so there will be several hospitals. They might all be working independently, but they are actually overseen by a particular sector head. And then actually growing our occupational health and well-being people to actually take forward the strategy, and then finally growing impact and evidence base. So what have we done? So under each of our drivers, as you can see there are particular actions that we have taken, and remember that this is only our first year. I'd like to just talk to you a little bit about those actions that we've taken, and then conclude this particular section on what our achievements are so far before I go on to some case studies. So when we talk about the strategic identity of occupational health and well-being, what we were told by our stakeholders and also our OH people is actually what we need to do is integrate occupational health and well-being as part of a continuous work stream. We need to develop and support our occupational health professionals to have a say at board level and be able to directly influence policy and process within each organisation. We need to take a proactive, preventive role in preventing ill health and actually going from what traditionally has been, due to lack of resources, a reactive service to a proactive, preventive service. And of course, engage with stakeholders at a national, system and organisational level. In terms of growing our occupational health and wellbeing services across systems, what we've actually done is collaborated across a sector. So hospitals and occupational health services across each sector are now talking to each other. They're sharing good practice. They are sharing resources. So, for example, like in India, in the UK, we don't have enough expertise in occupational health. So what we are now doing is sharing expertise across a sector to benefit several hospitals rather than just one. Integrating service user pathways with an emphasis on proactive and prevention, diagnostic and treatment services. We're maximising technology across systems to drive up efficiency, and all of this is allowing communication between hospitals in a much more preventive, proactive and efficient way. And we're also working with our organisations that perhaps haven't traditionally had access to occupational health to be able to do so from the neighbouring larger hospitals. Of growing our occupational health and well-being people, this has actually been a big part of the work that we have done over the last year. We've looked at a multidisciplinary workforce and now have job descriptions and training programs for AHPs, that's physiotherapies, occupational therapies, and also health and work medical champions, also sitting at board level across all hospitals now are what we call health and well-being guardians, who have a voice at that top table, who can present the culture and the importance of occupational health and well-being across the organisation. We're developing our future leaders, and we've invested in leadership programs, both for our managers, but also for our clinicians who are actually taking up leadership roles. We're also empowering our clinicians, and it's important that our clinicians can talk to our senior leaders, to those that are the decision makers who hold the purse strings in our organisation. So we are actually empowering our clinicians to be able to take up some of those leadership roles, to talk the language that our financial directors talk, that our CEOs talk. And we're also investing in training up doctors, nurses, OTs, physios, healthcare assistants in being able to take on more occupational health and well-being work by investing in diploma programs, some of which you will be aware of, run by the Faculty of Occupational Medicine. Finally, our final driver here is growing occupational health and well-being, the impact and the evidence-based practice. So again, what we've been doing is supporting our occupational health and well-being services to use common, quantitative and qualitative output-focused matrix to demonstrate their impact and their value in an organisation to drive up best practice. And we've also been supporting research and innovation and capturing best practice. We've been looking at IT systems and sharing knowledge and upgrading our systems to be able to produce the sort of information that we need, that we can present to our senior leaders to demonstrate the impact and the value that we have as occupational health and well-being services. So what have we achieved so far? Well, as I said, we've launched our 5-year strategy and we're in the first year. We now have a representative at board level across every single hospital in England that has the agenda of representing occupational health and well-being for all our staff across the NHS. This holds our CEOs to account and encourages investment and interest in what we are doing. We've got a big programme of gap analysis with actually investment in research and also digital innovation across our systems. We're at the beginning of this journey, so there's quite a way to go. It's an exciting time, and hope that in the future I'll be able to come back and present more of what we're doing. But before I finish, I'd just like to share with you some case studies. But actually what I did forget to say is that we have actually trained up hundreds of managers as well through our leadership programs over the last year, and also many doctors and nurses to have a qualification in occupational health. And we're following that through with supporting them. So we're not just training them and then off they go. We're actually then supporting them to also become senior leaders and nurture others who are then coming through the system. So some of the things that we've actually done here is a trust that's done quite a lot of work around the health and well-being framework. There are 7 actions, and they did a big piece of work around a gap. And as a result of doing that, what they have done, they've got 70 key actions, smart actions that they are following through as a actually priority for occupational health, but also for the organisation to develop. And that's been directly as a result of some of this work. The particular project is at Manchester University, and here they've empowered their managers. So these are not necessarily occupational health people. These are the managers in the organisation. And often you will have heard the phrase that people leave managers, not their organisations. So we've actually done quite a lot of manager training on having those well-being conversations, empowering managers to actually have conversations with members of staff who might be going through a difficult time due to physical ill health, psychological ill health, or just a difficult time because it's a difficult time in their personal life, or a combination of all those things. And that's having some really fruitful outcomes at Manchester. And this is the very final case study. This is actually in my trust. We analysed our staff data, and we have a workforce, again, 70% female, of which 50% are over the age of 40. We analysed referrals to occupational health and the type of referrals, and realised that actually what we really needed was a staff menopause support service. And we launched the support service, and it's been very successful. There are 3 arms to our support service. There is a lunch and learn session that's open to all staff, and we encourage the men in our organisation to attend these sessions, really also to learn, and many of them have come along and said, well, actually now I understand a member of my staff a lot better, or I feel more empowered to be able to support and have these discussions. But many of the men in the audience also said, okay, now I understand what my wife has been going through, or what my partner has been going through. And we have different themes for these lunch and learn sessions, and they are open to all our staff. And then we have a support line for our staff who might be going through the perimenopause, menopause, and actually for our male staff who might be also having, a challenging time at home with their female partner, but also for our managers who might not know how to have some of these conversations. And finally, we have a one-to-one staff support session. And these are, it's a good example of use of multidisciplinary teams. Support sessions are actually run by our pharmacist who specialises in menopause. And she does an absolutely exceptional job in having the initial conversations with a doctor as backup if required. We have a physiotherapist who actually does pelvic floor exercises and talks about exercise and menopause. We have a dietitian who talks about nutrition and menopause, and the service was launched last summer. And as a result of a huge demand, we've actually doubled up the sessions that we are providing each week. So a good story, and certainly something I know that many hospitals in England are now replicating. So we'll end there with some further sort of reading if anybody is interested in looking at more of what we're doing in England. So I thank you all for listening, and again, thank you for your kind invitation to be here today.